Hey guys, it's Dr. Tara. I am here live on our Adora Hair Loss Community Facebook group. As promised, every Thursday at 6 p.m., we're going live to talk about all things hair, all things products, all things trichology, all things wellness. So I'm going to give it a few more minutes for some of you to join me. I'm so excited. I'm excited for everyone who has joined this amazing group, everyone who has come with trust and confidence that I have the skills, the tools, and the expert advice to get all of us to a healthy place, not just with hair loss, but emotionally, mentally, psychologically. Just to get us to a place of wholeness. So I am going to give it a few more minutes and wait for more people to come into the room. Come on in the room. I am here. I am here. I see my brother is here. Ricky, how are you doing, sir? I'm so excited to see you. That's my big little brother, y'all. So I need a few more people to join me. I know this is our Facebook group, but if you know anyone that's in the group, your friends, your family, your Facebook friends, if you can tag them and say, hey, Dr. Tara is live. You don't want to miss this. I'm doing this once a week, every Thursday at 6 p.m. And I believe our cutoff time is going to be about 30 minutes. I'm going to try to gauge that and see exactly when we need to end, but it's going to be around that time. But I need a few more people to come on in. Come on in, come on in, come on in. I am here live. We're going to talk about all things hair. We do have a topic for today. And I put up a post last week that I will be doing this every single week. Most doctors, trichologists, healthcare professionals are not doing this. They're not sitting down with you for free to answer all of your questions, all of your concerns, truthfully, transparently. And I am here willing to do that. I just need you guys here to engage with me, join me. This is important every single Friday. There's my sis. Hey, Tamala. Happy birthday, girl. My sister just had a birthday, y'all. She is younger than me. I have to be very careful. She is younger than me. Not by that much, but I am so glad, Tam, you're here to join me. So again, if you have family and friends who are in this group, Facebook friends, let them know that I am here live. Dr. Tara is here to answer all your questions and concerns. And it's an honor and a privilege for me to do this, but it's more of an honor and a privilege for you all to be here, to get this information, get the expert advice you've been looking for, to have real talks and real conversations about anything hair, anything scalp related. You have a product question, you have a hair question, doesn't matter what it is. I am here and I'm available. So we're going to give it a few more minutes and we will get started with who's already here. Happy Thursday. I hope your day has been amazing. Mine has been amazing. It's been very busy, but it's been amazing. But I am here. I need a few more people to join me. Thank God for my brother that's here. Thank God for my sister that's here. Just waiting for a few more people to come. And as I stated before, I will only be going live in the group. I will be doing some videos and reels on my personal page. And I will be doing a few snippets from here to put on my personal page just to get people to engage and to encourage them to follow the group. But all of our information, discussions, all your free tips, and everything that I'm just giving out and sharing with you all will only happen here. It's not going to happen on my personal page. So if you want to talk to me directly, have those conversations, we're doing it in the group. We're doing it in the group. So, How many do we have? We have a few more. I'm waiting I'm going to give it about one more minute. I'm going to give it about one more minute. And then we are moving on. But I'm excited, y'all. I'm excited. And you know what? You know what I'm really, really excited about? I launched this group, I want to say it was last Sunday. Maybe, yeah, I think it was Sunday or Monday. And you guys know we are up to 100 members. I could not believe it. I'm being honest. I was in total shock. But you know what? That just let me know that I'm on the right track. I knew this was necessary and it was very needed. I also knew that I was supposed to do this a while ago, but everything is in seasons. So I'm very excited to have all of you here to be a part of this and to share in this experience of just getting healthy and just, walk into a place where we're not just healed, but we're whole. And I need my glasses. How many do we have? Oh, we need a few more people, but we're about to move on. We need a few more people. And I guess, and again, it's our first one. So, I'm never discouraged anytime I start something. You're never in how you start, Doesn't matter how you start. What matters is how you finish. So we all have to have a day one, and that's a lesson right there. We all have to have a day one. So you start with a little, but at the end of the day, the prayer is that you end with a lot. So we're starting this live with just a few of us, but I believe that the more and more we do this, the more and more people will engage. They'll get used to seeing the posts that, we're doing this on Thursdays, and more people will join, and not just that, people will get a chance to watch the replay. So that's fine too. So I just want to open up the floor and see if anybody has any questions, any concerns. Also, if you all can let me know how the audio sounds on your end. Is it clear? Is it skipping? Is it acting kind of funky? Let me know. I set up a little space here. I'm not a very over the top person, but I set me up a little space, and this is where I'm going to be every time we do our reels and things. Every time we do our live. So, just let me know if the sound is okay. It sounds okay to me, but of course I'm not on the receiving end. So does anybody have any questions, any concerns? Because I'm going to cover a couple of things. Okay, so we are moving on. So prayerfully everybody will catch the replay later. So, hi again everyone. It's Dr. Tara Teodora, trichologist, holistic doctor, as well as a wellness strategist. And the whole purpose of this group is to bring those together who have suffered with hair loss, going through hair loss, coming out of hair loss, not sure if it's even hair loss, like what is going on. Something's happening, but I'm not sure what's happening. Then this is a place for you. It's a safe space for us to just talk and network and engage to help you get to solutions to get your hair and your scalp and you back to healthy. That's something that I'm very passionate about, just getting to the root cause of us. And we're going to dive into that more as we continue to build a group and continue to build these live discussions. So I'm not coming straight out the gate with a lot of deep, in-depth information. I'm giving some of the basics because some of us just don't even know what a trichologist is. So we'll touch on that tonight, just the basics. And hey, Jaheem, how are you, little brother? Good to see you. I'm on it, sir. And so the more people that start to engage in the group, the more in-depth the conversations will become. So we're going to be diving into that, getting to the root of you. We're out here dealing with these hair issues, dealing with these scalp issues, and many times, we think that it's products, we think that it's genetics, and I'm not saying that it's not. I mean, that could be the symptoms that you are dealing with, but a lot of times it's the emotions that is really the culprit of what we're dealing with. That's something we're going to talk about, when we talk about alopecia. As a matter of fact, that's the topic for today. What is alopecia? But first of all, I just want to go back to the basics because some of you may not know. I know I've touched on it. But the first thing I want to explain is, what is a trichologist? So a trichologist is a hair doctor. That's what I do. You have certified trichologists, you have clinical trichologists. Either way, you have to go to school, and we go through a rigorous program where we're trained to look at scalp, to dissect hair, with treatment and with tools and gadgets and all these little toys that they give us, because that's what they are, like little toys to me, because they're so much fun. And but not just that, we learn the biology and the chemistry behind it. We learn about cranial, we learn about scalp, we learn about the cellular level, we learn about follicles that sit inside of a dermal papilla, and that's where hair grows, because it grows in layers, and that your scalp has all these 5 different layers and things like that. So it's a lot of training that we go through. But what we do is we diagnose and treat scalp conditions. That's what we do. So the difference between, and I get asked that question too, what is the difference between a trichologist and a dermatologist? Well, a dermatologist is someone who treats and diagnoses skin, period. All vast amounts of skin. So when it comes to dermatologists, they're dealing with maybe a boil that you're dealing with, a sunburn that doesn't heal, maybe some kind of cancer spot, or something that's going on with the skin, a very, very bad infection, things of that nature. So they're treating all the skin that's all over your body. And so their clientele is very vast, because people are dealing with all sorts of scalp conditions. But when it comes to a trichologist, the only thing we deal with is scalp. So why is that? Because scalp is skin. So we deal with scalp all day, all night. Whereas with a dermatologist, they deal with all vast amounts of skin. So I see clients every day just for that, scalp and hair conditions. Whereas with a dermatologist, they may see a person that's dealing with hair and scalp conditions every now and then. Many times they'll call us and say, hey, can you take a look at this? I'm not sure what this is. This is what it looks like to me. This is my diagnosis. What do you think? Because they're dealing with the scalp and then some. So that's the difference. So because we deal with scalp and skin, our treatment is a little more broader. Our diagnosis is a little more deeper. Even down to our education and training is a lot more in depth when it comes to that. So that's the difference. So we deal with hair, scalp conditions. We make sure that we stay up to date with the latest trends and the latest things out there. And we're taught to treat men, women, and children. It's not just women that we see. We see anyone with hair loss, because listen, let me tell you something. Hair loss does not discriminate. It does not discriminate. Man, woman, boy, or child, it can happen to you. Your follicles do not discriminate. I get asked that all the time. So Tara, is there a difference between men follicles and women follicles? No. Follicle is a follicle. So hair loss does not discriminate. Your follicles can grow and shrink on anyone, man, woman, boy, or child, like I said. So that is the difference between a trichologist and a dermatologist, just in layman's terms. And I've been doing this for some time now. So just wanted to put that out there. So let's dive into today's topic. I'm trying to see what time it is. I'm trying to stay on point. It is 6:15. Also, I need more people to join. But we're going to go on and get started with our topic. But in the meantime, please, ma'am, sir, if you have any questions, I am here. Please take advantage every Thursday when I come on here. I take the time out of my schedule, to come here and to be a part of what's going on in your life, in your health. So please ask me any questions. You have any concerns, you can write it on the little timeline. You can put it in a post. But when I'm doing these lives, I would prefer for people to do it in real time. That way I can talk directly to you. Hey girl, this is what it is. This is what it isn't. This is what I suggest. This has been my experience. So that way you get real time answers. We can dialogue back and forth. If you're not clear, follow up with another question, and we're going to keep going until we get it. So definitely ask here. So not sure how many we have. I don't have my glasses, but we're going to keep going. So today we are going to talk about what is alopecia. What is alopecia? Not sure if any of you know what alopecia is. Oh God, my mama's here. Hi, mommy. It's Camille, y'all. Hi, mommy. How are you? I am so glad you joined. Make sure you watch the replay to get all the beginnings. But we're going into our topic, Mom. What is alopecia? I get asked that all the time. What is alopecia? So I kind of like touched on it when I went live the other day, a couple days ago. And so I wanted to dive into that because that is like one of the number one questions that I get. Hey, Al, how are you? That's my little brother. Y'all are coming on in. Come on in. Come on in. Hi, Tanya. How are you? Pastor. Love you, girl. Hi, Trina. I'm so proud of you from Sunday, girl. How are you? Come on in. Come on in. Come on in, everybody. And it's awesome that you guys are coming in because we're just about to start our lesson. I just broke down what a trichologist is. I just broke down the difference between a dermatologist and a trichologist. So when you all get a chance, go back and watch from the beginning so you can get that explanation and just understand the difference. And, our level of expertise and the scope of what we do and don't do. And that's something else I have to throw out there that's very, very important. And some of this stuff, y'all, I'm telling you, it's not just law, it's ethical. Okay. So sometimes I'm just going to share information that you may not know. Doctors may not tell you. You may not have experienced it, but if you hear it or see it, you'll know exactly what to do. And here's one of them. As a trichologist, there is a scope that we have to stay within. Some things we can and cannot do. Okay. So if you ever go to now this is not a dermatologist, this is for like trichologists and things like that. Trichologist, a natural hair loss practitioner, a hair practitioner, a natural hair specialist, and things of that nature. If you ever go to see one of those for treatment, and I'm not saying don't go to a hair loss practitioners because, they do have a level of expertise where they can help you. Trichologists, we got papers to do this. This is a whole different, and it's some things that we've been trained to do that nobody else can do outside of a dermatologist. But anyway, if you ever go to any of these healthcare professionals and for scalp and hair issues, and you were told that your scalp is inflamed, as a trichologist, we cannot treat an inflamed scalp. If you go to a trichologist or a natural hair specialist or hair loss practitioner or someone like that, and you're told that your scalp is inflamed, and they say, well, you know what? Well, we can go and start your treatment. Run. Not only is it unlawful, it's just unethical. We as trichologists cannot treat an inflamed scalp. Now, there's herbs and things that we can create. There are therapeutic remedies and holistic practices that we can put in place to help bring down not just the inflammation that's in your scalp, but in your body, because something's being triggered by something. And we'll talk about inflammation. That's going to be a whole nother lie. But anyway, only a dermatologist can bring down inflammation like immediately. Like I said, there's holistic practices. It may take a little while, maybe like a couple days. It all depends. And I don't like throwing like definites out there because everybody is different. What the inflammation is stemming from is different. Your age, your genetics, that all plays a part. So I don't want to throw out too many, definites, but a dermatologist will most likely give you some kind of steroid cream, steroid injection, corticosteroid to bring down the inflammation, because we can't treat inflammation because the inflammation is what's going to block any and all treatments. Okay, so I just wanted to throw that out there. So, there's some things that we just cannot do. Okay, but back to the topic. So what is alopecia? I said earlier in the live that alopecia is a term used for any hair loss. Doesn't matter. It's all alopecia. Alopecia simply means hair loss, but there's different types of alopecia, and that's what we're going to get into. So, so first of all, let me say this. When it comes to alopecia, it can happen at any time for any reason. Okay. Anytime, any reason. It can begin at any age. So I would say for men can start to see hair loss at the age of, between the ages of their 20s and 30s. It can happen that early for men. For women, we tend to see hair loss like around our 40s to 50s. Okay, I said before that it is not uncommon for men to lose their hair much faster than women. Okay, it's not that one can be treated faster than the other. It's just a matter of, whether it's men or women that lose their hair faster. It's just a fact. It is what it is. And so normally when it comes to alopecia and hair loss, it tends to start, and when I say 10, I'm talking about a small spot or a small patch that usually starts at the scalp, and it starts off like a small patch or a small circle. That's one of the first signs of alopecia or hair loss. I'm using those words interchangeably, so because one doesn't mean any more than the other. Alopecia is hair loss. Another way that you can possibly may realize that it's alopecia is when you start to see like small dents or pits in your fingernails or toenails. Like those, how you have those dents across your nails? Or you may have dents across your toenails. Don't ignore that. That is definitely medically a term that we use to signify that someone may have hair loss. So anytime you see dents in your nails, and they can be circle dents or line dents in your nails or toenails, talk to your healthcare provider. And I'm not saying that, oh God, that's hair loss. It could be anything. It could be anything, but they can run tests and have that looked at. But many times when you see those dents and things in your nails and fingernails, that can be an indicator that you could be suffering or struggling with early set on hair loss. Okay, so let's get into it. So who out there knows, I would say, is the number one hair loss when it comes to alopecia that people are suffering with? Does anybody know? I know we have a few more minutes, but I promise you, I'm gonna stay here until we're done. So we're not gonna be an hour, but we are gonna get through the topic. So is there anyone who knows what is the number one type of alopecia out there? And again, if you all have any questions or concerns, it doesn't have to be about this topic. It could be anything that you're dealing with, anything that you're struggling with. You saw something in your scalp. You felt something in your scalp. You see too much hair in the comb. You see too much hair in the shower. You can't retain moisture. You bought a product and you feel as though, okay, it did something to your hair. Listen, that's a thing too. We're buying products and it can alter your hair strands as far as how your hair responds to it. That is a medical term, and we're going to get into that later. I don't want to give everything out tonight, but we're going to talk to that. How products can literally damage your hair, and you literally have to go through some kind of treatment or some kind of regimen to restore your hair back to healthy. That is a thing, and we are going to talk about that. So the number one hair loss that I would say millions of people are suffering with is alopecia areata. Not sure if you're familiar with that term. I probably see about, I would say, 40% of clients on a yearly basis who have dealt with or are still struggling with alopecia areata. So what is alopecia areata? Well, actually, it is an autoimmune condition where your body literally attacks your own hair follicles. It's an autoimmune condition where your own body attacks your hair follicles. And it actually causes like these patchy hair losses, like little bald spots. Remember, everything starts small. So when you start noticing small spots, some patches, maybe a swirl here and there, don't dismiss this, because something small, especially if it's hair loss, anything in the scalp where you're losing hair in any kind of form, you start seeing where you had hair, and now all of a sudden that fuzz is getting wider and wider. You're starting to see more and more scalp. Don't dismiss this. It's not going to go away. It's only going to get worse. So when it comes to alopecia areata, you'll start to see like these little small spots, about like this. It could be any size, and sometimes it starts as like a dime size, okay? And it can range from a small bald spot, and it can actually start to grow where now hair loss is forming on the scalp, okay? And like I said, it's not gonna go away. It's gonna get worse, and you will either get to a point where it could develop into total hair loss. There's a medical term for that. It's called alopecia totalis. Or it can evolve into alopecia universalis, which is alopecia, which is hair loss all over your body. That is a medical term. And when I say all over your body, meaning you'll get to the point where you'll have hair on your head, you'll have eyebrows, you'll have eyelashes, and slowly but surely you start to notice that, wait a minute, this hair is getting thinner and thinner, not just on my hair, but all over my body. And eventually you'll lose your eyebrows, you'll lose your eyelashes, you'll lose the hair that's on your arms, your fingers, and the medical term for that is alopecia universalis. Alopecia totalis is when you just lose all your hair all over your head only. Okay, so there is a difference. Okay, so can you regrow your hair when it's diagnosed as alopecia areata? Yes and no. So you can regrow your hair, sometimes on its own, but many times it's going to take treatment. And it depends on what is and what is not happening with your immune system. Okay, so it depends on things like that. So what do I mean when I say immune system? So alopecia areata it usually develops, and I say develop because there's no cure for alopecia areata. Okay, you get to the point where you can manage it, and you can manage it to the point where you may not see it for weeks, months, sometimes maybe a year or two if you manage it well. That comes with treatment. Yes, treatment, but the main thing that helps to manage alopecia areata is lifestyle changes. There's things that you're going to have to do environmentally. There's things you're going to have to do internally to kind of like manage and go back to what I was saying. So when it comes to alopecia areata, how do I manage that? There is no cure for that. So how do I manage that? Because it is an autoimmune disorder. And that autoimmune disorder is caused by triggers. Something has to trigger something that's going on in your body for your hair or scalp to now flare up and cause these patches. So what are the triggers? Well, the triggers could be an emotional shock or stress. It could be a major illness. It could be hormonal imbalance. It could be environmental factors. It could be so many things. It could be caused by medications that we're on. So it could be definitely from diet. There are certain foods that you just should not be consuming. Foods that are high in sugar, sugary stuff. Lots of coffee and tea. Now, I'm a coffee drinker, so I thank God that's something that, I've never had to deal with. I do see it in a clinical setting. And so I know, and I try to drink coffee in moderation. I try. But I also try to drink a lot of water to kind of like balance that out. So we're drinking coffee and things like that. Just make sure that you're getting in and you're consuming at least 3 times your water intake, per cup of coffee. Drink some healthy teas and things of that nature. But back to what I was saying. So it's triggered by something that you're going through emotionally, something that you're going through psychologically, mentally, and physically. So you have to get those triggers under control. That's the main thing. You have to get the triggers under control. You have to get your diet under control. So the best way to deal with alopecia areata is to then partner with your healthcare professional, because they can actually run tests, run blood tests and things of that nature, to see what your iron levels are, to see where you are as far as deficiencies. We're going to talk about that. That may be something we talk about, because I'm trying to build up this live. I need more people to join in before I start going in depth in conversations, because we need to talk about these vitamins. There are vitamins that we need to consume, not just for health reasons, but if you're dealing with certain hair losses and scalp diseases, these vitamins and minerals are crucial to not just managing, but many times reversing things that we're seeing in our hair and scalp. And we see it, we talk about vitamin A, we talk about vitamin B, and I think we just use these terms loosely. And I don't think people understand the chemistry and the power behind what these vitamins and minerals can do, not just for your hair and scalp, but for your body as a whole. Taking a B12 and taking a B7, your B7 is your biotins and things like that. That is wonderful. But when you then combine these Bs into a B complex, how powerful that is. We're going to talk about water soluble and suitable vitamins and minerals, because there's a difference. Why do I take water solubles, and what does the non-water solubles do, and how does that respond to my body? So we're probably diving into that maybe like the 3rd or 4th week of us doing lives, but I'm trying to promote these lives more so I can get more people in tuned. So we'll probably start going in depth, like I said, in about maybe like our third or 4th lot. But anyway, I want to cover one more, and then we're going to kind of like close out. Does anyone have any, does anyone have any questions? I don't see any. I'm here, y'all. And the questions don't have to be about this topic. It could be about something that you're dealing with. Remember, a lot of us are here because we're looking for answers. We're looking for solutions. I'm here. So feel free at any time to jump in, write your question. I'm going to answer it right there on the spot. I'll stop what I'm doing, stop what I'm saying, to get to the heart of the matter of what you're dealing with. Okay. And we'll talk about it. I promise you, we'll talk about it. So if you have any questions or concerns, please, please, please ask me. I'm here live, and we'll dialogue back and forth until, you get an understanding. Okay. All right. So let's talk about, the next one. I want to talk about one that affects, I would say, African American, especially African American women. It affects, from the studies that I've done, anywhere from 65 to 75% of African American women. And that is scarring alopecia. I know we talked about alopecia areata, but let's talk about scarring alopecia for a minute. I'm not sure what time it is. It is 6:35. I know I probably gave about 5 minutes for people to join in, but I'm going to stay on for about maybe 5 more minutes, and then we're going to end, and we'll pick this up on another, maybe next week or something. But I do want to touch on this. So scarring alopecia is a form of alopecia. Remember, alopecia is hair loss. Okay. So scarring alopecia is a form of alopecia that affects the majority. When I say a majority, meaning you primarily see this in African American women, not so much men, African American women. And this type of hair loss occurs when hair follicles can be permanently damaged or semi-permanently damaged. So, Tara, what does that mean? So when it comes to scarring alopecia, there's a medical term for that. It's called CCCA. I wrote it down because it's a long word. And that word means, where is it? Centrifugal cicatricial alopecia. For short, those of us in the medical field call it CCCA. I'm going to say it one more time, and you can Google this. It's centrifugal cicatricial alopecia. That term simply means scarring alopecia. So scarring alopecia is a hair loss that occurs when hair follicles are destroyed or can be damaged by something mechanical. And we'll talk about that in a minute. And when your hair follicles becomes almost destroyed or almost damaged, what happens is that those follicles are then replaced with scar tissue. Okay. And if that scar tissue doesn't heal, then it can cause permanent hair loss. What do I mean by that in layman's terms? Okay. When I say mechanical damages, that falls under the line of traction alopecia because it kind of like goes hand in hand at sort of kinda. So when I say mechanical damage, that means these are practices that are self-inflicted. That's a mechanical damage. That's a medical term. That's a trichology medical term. So you start to see what is called traction alopecia, because that's how it starts off. It mainly starts off as traction alopecia, which we're seeing more and more in African American women as well. And I'm going to tie the two together, but normally it starts off as traction alopecia, which can lead to CCCA. So let's talk about traction alopecia, which I guess you can say is number two, the third type of alopecia. So traction alopecia is a form of alopecia that occurs when we're wearing tight styles that's causing a lot of tension. Traction alopecia occurs when we're wearing styles like weaves and braids, tight wigs, tight ponytails. You know, I had braids. I'm in a protective style right now. And if these were super, 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 super tight for a long period of time, this could cause traction alopecia. And now, to be honest, you know, in a clinical setting, I would say about 80% of the clients that I see have some form of traction alopecia because we're in weaves and we're in braids and we're in these high pony. I don't even know what y'all call them when they slicking it back with. Listen, I don't even know why it takes that much gel and the edge control, but that's a whole nother podcast for another whole nother day. But we are literally plastering. That's what it seems like sometimes. Our hair down and it's pulling so tight. And then we're, you know, winding the hair and these ponytails, you know, they're slicked back and we're wearing them for such a long period of time. I had one client, she came in to get her ponytail done with my stylist. And the next time we saw her, it was like almost 3 weeks later. It's like, girl, you've been in a ponytail for 3 weeks, a whole 3 weeks. So when you're causing that much tension and tightness, it can cause traction alopecia. So Tara, what's the damage? Well, the damage is when the styles are so tight and there's so much tension that you're literally pulling the hair from the scalp. It's either pulling, it's snatching, or ripping. It's doing one of the three. And sometimes you can snatch hair and pull hair because of tension so much that a lot of times we will take the hair with the bulb. I mean, the hair and the bulb comes out, you know, and the follicle. I mean, sometimes it's just the hair, sometimes it's the hair that's attached to the bulb, and sometimes it's the hair, the bulb, and the follicle. And once your follicles are damaged, because that's traumatizing to the scalp. Anytime you rip, pull, or snatch hair out of the hair follicle, especially taking a bulb with it, that's hair damage. That's trauma to the scalp. And you have to do one of two things. Either you have to wait until it self-heals, or you have to get treatment. And a lot of times, if you're self-healing your scalp, first of all, you can't see how much damage that is. That's why it's imperative that you come see someone like me. So, or see a healthcare professional that is knowledgeable in hair and scalp conditions, because, you know, it's only with devices can we look into your scalp and see just how much damage and just how much trauma has been caused to the hair and scalp, because we'll be able to, see beyond just the naked eye, because you're just looking at your eye and seeing this red spot. It's really not telling you anything, because now you don't know what's going on underneath the surface. And we can see if there's still a follicle there. We can see if there's hair strands or hair growth in that area, because you can't tell. And if the hair doesn't heal on its own, something's wrong. If there's hair that's not growing, because if your hair is too traumatized and too damaged, scar tissue will form. And over time, you'll be able to tell that. But many times we can start treatments to help to repair and reverse a lot of that before it gets to the point where now your scalp, well, I want to say cells, your cells and your follicles just die. You don't want that to happen. So what we try to do is help to save our hair, save our follicles by starting treatments early and starting to rejuvenate those new hair cells. We're going to get into some biology too, y'all, so y'all can kind of like understand how this whole process works. Start rejuvenating those hair cells before it's too late, because cells are always replicating. They're always duplicating. Cells are dying, and cells are living, dying, and reproducing all at the same time. And you want to make sure you keep that cycle going. But if your follicles are damaged, if your follicles are traumatized, you're not going to see new growth. And so again, that takes a whole nother level of being able to see what's going on underneath. But anywho, so that is traction alopecia. When you're wearing these tight styles, braids, weaves, listen, and I'm not coming for anybody. Let me tell you, I see people with weaves all the time, and I get it. There are ways that we can safely wear weaves. That's why I had my stylist Jasmine here. She is great with styling hair, my clients who are dealing with hair loss. So she knows how to style and do a workaround where she don't compromise whatever I do in treatment. And if she's not sure, she knows how to come get me. Tara, come look at this. What do you think? And I'll say yay or nay. So we work as a team. So I'm not that one to say y'all need to stop wearing weaves, because you're going to do it. Listen, you're going to do it. I'm in the process now of creating a whole new packet, a whole new set of products coming soon, just for those who are wearing weaves. Yes, a collection and a treatment at home just for you. Stay tuned. So I got you. I'm not one I'm not weave bashing. I'm not doing that, because we're going to do it. We're going to do it. So why not help you safely wear weaves and get your scalp, reverse whatever's going on while under weave, and get your scalp back to healthy. And you can still rock whatever, but we're going to do it in a safe, holistic way. How about that? And still get your hair growing, your scalp throbbing while under a weave. Stay tuned, y'all. It's coming. I'm telling you. But anyway, so, we're wearing these weaves and things, and we're not removing the glue safely. We're in a hurry, or we're not sure what to do. We only know what we know, and we're not removing the glue, and we're removing these weaves, and it's taking the follicle, it's taking everything with it. And so you see traction alopecia a lot of times when the hair line and the hair edges is just gone. And let me explain something real fast to you. When it comes to hairline and edges, that's a whole nother conversation, but I guess we're going to have it now. So when it comes to CCCA, when it comes to traction alopecia, that's just it. A lot of times it looks like a track of hair loss. It looks like a whole line or a whole row or a whole I can't think of the word, but I think y'all know what I'm saying. Like a whole just track of hair loss in one specific area. It could be in the crown, but you mainly see it around the hairline. You can see it around the nape. You can see it like on the side or across here, but normally it's in some kind of line or a track. And a lot of times that's stemming because of the glue that we're using. It can stem from edge control, because one thing you have to realize, our hairline, there's a medical term for this, because you have different types of hair, different types of hair growing out of your head. So let's start with your hairline. The hairs that you see here, the medical term for that is vellus hair. Vellus hair is the hair that grows along your hairline. That's the hair that grows, and they always say, that's my baby hair. Let me lay down my baby hair. And that's exactly what it is. It's very, very fine hair. The medical term for very, very fine hair is called vellus hair. It will never change until the day you die. That is a hair along your hairline. The vellus hair also grows within your scalp. When your hair first starts to grow out of a hair follicle, it starts off as vellus hair. And then it grows into mature hair. The medical term for mature hair is called terminal hair. So you have vellus hair and terminal hair growing within your scalp all at the same time. But vellus hair is what you're going to mainly see along your hairline. And if that vellus hair resembles baby hair, what does that mean? It's very, very fine. So if your hair is very, very fine, how much edge control? Yeah, I'm going somewhere. How much edge control? How much gel? How much glue do you think your hair strand can handle? I mean, your hairline can handle? Because, listen, once you lose this vellus hair, which is a whole different type of hair that's grown within your hairline and your scalp, once you lose vellus hair, it is a proven medical fact. It is the hardest to grow back. Why you think so many people are out there on the internet trying to find all these oils and all these herbs and all these things trying to get back? I gotta get my edges back. My edges won't come back. I done tried everything under the sun. Because once they're gone, baby, it takes forever for some people, depending on how much damage, depending on genetics, depending on diet, depending on all these other factors. Outside of just losing your hair because of glue. It depends on all these factors that would determine how fast you get your hairline back. So if it's baby hairs, then what you have to do is baby them. I'm not a fan of edge control. That's just me, because you can get some castor oil and some oil and just lay them down and let them do what they do. Let them do what they do. They're beautiful. It's gorgeous. It's soft. It's sexy. It's feminine. Let your edges, let them be girly. That's just me. I'm not, and again, I'm not bashing. But the one thing I'm saying is take care of them. Moisturize them, oil them, just maintain and make sure they're just healthy. Don't ignore, don't do anything to compromise their growth, because they're thin. They're very, very fragile. So you have to baby them. Okay, that's all I'm saying. But anyway, so that's traction alopecia, when you're losing your hair from tension and things like that. And if that tension gets so severe and the hair loss gets so severe because we're steady pulling over and over again, or we're pulling so much that we're pulling out the follicles and it's so damaged to the point where it's destroyed, now we're looking at CCCA. Because CCCA is when hair follicles are so damaged, it's so much scar tissue that it's irreversible. And now you're dealing with permanent hair loss in that area. CCCA normally starts at the crown of your head and just spreads. Now, is it a fact that people out here who have been diagnosed with CCCA really has CCCA? No. Because I've had people coming here. I just put up a post maybe a week ago with a client who was diagnosed and she wasn't. And her hair, we got her hair growing. It takes a level of exams to determine that. We go through a rigorous history. Like, there's a lot that I go through and a lot that I work with, my clients on to determine if it's even CCCA. And I said before, you never give up on your hair. So just because you've been told something, don't crawl under a rock and say, oh my God, all hope is gone. No. Go get another opinion, and then go get another opinion. But why do that when you can just come see me? One, I'm going to tell you the truth. Number two, I'm going to work with you, okay, until we get somewhere. You never give up on your hair. I'm not giving up on you. So you don't give up on yourself. So if you're out there and you're not sure because you're seeing these spots, you may have had some damage because you ripped out the glue a little too fast, or, these unhealthy styling practices. You just took out braids and your hair is just shedding profusely. Come see me. call me. I have virtual appointments. I have in-person appointments, but you don't have to, suffer wondering, is this alopecia or not? What is going on with my hairline? Like, you don't have to. You don't have to. We can sit here virtually, and I can look at your hair virtually, and we can do a consultation virtually and kind of like figure out what's going on, or just call me. But definitely I am here if you have any questions, if you're just not sure. But that is one of the topics that I wanted to cover today. We can dive into this some more next week, because when it comes to hair loss and alopecia, it's like the sky is the limit when it comes to these different terms. But I just wanted to touch on a couple. Alopecia areata, CCCA, traction alopecia, hands down is the top three that you will hear about most, will talk about most, that is really prevalent in our community, in our culture, that we as African American women see more than anything else. So so when you get a chance, go back and watch the replay. Those of you who weren't able to catch the live, still feel free to leave any questions or concerns here, because I will be checking back and responding to your questions and your concerns. But I would love to see you all join me live when I do these session, so that way we can have a dialogue and talk, and I'm just not talking all the time. I'm actually talking to you. That's why I'm here. So I will be doing this every Thursday at 6 p.m. every single week. We're going to jump on here. I promise to be here, and I'm looking forward to you all being here too. If anyone is interested in a consultation, anybody's interested in just getting some answers, you can book an appointment or Dora Trichology and Wellness. I am here all day, every day. I do this full time. I live and breathe hair loss, scalp exams. So feel free to connect with me, book an appointment, and we can go from there. If you're kind of like still on the fence, like, I'm not sure, keep coming here. Keep coming here and getting some answers and building that courage and building that confidence, or hearing something that says, you know what, I think that sounds like me. Keep coming until you're ready to come see me. Come here. I'm okay with that. Keep coming here until you finally make that decision and say, you know what, I'm ready. I need to come and see Dr. Tara. I'm ready. But in the meantime, we're going to learn, we're going to grow right here every single Thursday. So does anybody else have any questions, concerns? And thank you all so much for being here. I'm so grateful to see each and every one of you, my friends, my family. Oh, and I forgot to mention, y'all, did y'all know? Well, maybe you didn't, because I'm about to tell you. We've had so many people join our group from, I forgot what part of Africa. In Africa, y'all, I think it's about maybe 26 to 30% saw our live and have joined our group from Africa. I'm so excited about that. So shout out to our homeland, Africa. I'm so honored to see you guys. If you guys are ever watching, if you're joining the live now or later, just write something down there and say, hey, Tara, we're right there with you. We need this information, and and we're just excited to be here. But that's all I have to say for tonight, guys. If you don't have any questions or any concerns or any other thing you want to talk about, I'm going to end this live. And I love you guys so much. I'm just so grateful that you took time out of your busy schedule to meet me here. I hope you'll meet me next week. But in the meantime, I'm going to continue to post every single day, answer all of your questions, and just engage with you all and engage back. I look forward to your comments, and you're saying things to other people on their posts, and that's what we need to do. We're trying to build a community where we're trusting each other, we're believing in one another, we're supporting one another, because guess what, y'all? We're all in this together. I'm right there with you. We're all in this together, okay? So welcome home, everybody. I'm just so glad that you have finally connected, and this feels like home. And I want that feeling for you too, that this is a safe space for us to talk about any and everything and be real and be transparent and be authentic. And that's something that I promise to give you. But until next week, I love you guys. I will talk to you soon, and I pray you have a blessed and prosperous week. I'm Dr. Tara, Adora Trichology and Wellness Institute, Adora Hair Loss Community. I love and thank you, and I'll talk to you soon. Bye-bye.